school means bringing home new books, fun stories, and sometimes germs. A cough or even a sore throat can give parents a few worries, not knowing if it's a common cold or just allergies acting up from playtime at recess. We sit down with Susan Sensaki, nurse practitioner with Dizon Pediatrics Center in Fresno, to learn more.
I actually stands for upper respiratory infection, and the name itself is misleading because infection, it's actually a name for colds or viruses, and the majority of colds are caused by viruses. With that, you'll usually have a runny nose, a cough, and a fever, and you won't feel well. A cold will self-resolve in about 10 to 14 days. But the fever is something that happens usually when you have a cold or a virus or a URI. With allergies, you'll often notice, like, why is this keep reoccurring? Like, why is there always a runny nose, a cough, and sometimes you'll have an itch? When it's very recurrent, and there's no fever, there's a lot of over-the-counter things, like Zyrtec is something that is very safe for children, FDA approved for over 6 months, Claritin, Allegra, and then if that isn't managing it, sometimes it takes a couple of days. If there's something like a cough or runny nose or rash, then there are other medications like creams, nasal sprays, Flonase, as well as sometimes if the cough is recurrent, and it is deep and it is not going away. If a school nurse is saying, like, you know, your child is coughing in the classroom or when running outside, it's good to go get your child checked, because that may go beyond needing just an allergy medicine, but an inhaler. The inhaler doesn't always mean that that is asthma. What we do is we call that reactive airway disease, and that means they are either reacting to the air, they're reacting to a virus, or they could be reacting to something like, there could be like certain things, food. But managing allergies is important, because then when they do get a virus, then that's further inflammation into what is already inflamed.
If your child is experiencing any of these symptoms, she recommends getting in with your pediatrician or urgent care as soon as possible. And if your child needs medications at school, it's important to remember to have your pediatrician fill out a medical form for your child's school.
The Clovis Unified School District, Fresno Unified School District, Central will each have their forms. It's nice to have it ready to give to their pediatrician, so it'll be ready to fill out. And it's also good to have a conversation with your children. Do you cough? I notice you're coughing when you run and play. Do you cough at school? Or your nose is always running. Should we start that allergy medicine? Do you feel better with that allergy medicine? So having a discussion with your child is also very important.